So, ma'am, a very basic question which comes to us through our patients, that can vaginismus be treated?
Yes, it can be treated, and there's a step-by-step approach to it, like I did in my talk, is to actually get to the root of what the cause is.
Yeah.
And because we understand that what the patient comes into the clinic with is not always the full story.
True.
Like the patient I described, they'd come because she was worried and she was anxious that the husband was going to leave her. They were going to have a divorce because the mother-in-law didn't like her. And then it was only after they started talking for half an hour and we kind of digging, what's the problem? They say, oh, but it's because we haven't had sex. I said, okay, then why haven't you had sex? So it doesn't unfold immediately as vaginismus being a problem. And particularly if there's a lot of relationship issues, there's outside influences, in-laws, etc., trying to influence the couple to break up.
Yeah.
Because of the mama's boy thing. So it's very challenging to find the cause. But sometimes what happens is, if there's a good couple relationship and then you have a diagnosis of vaginismus because of the anticipation of pain, all of the different criteria we talked about, then you can go about discussing psychosexual therapy with them. You can discuss desensitization. You can discuss couple relationship therapy with them. I have had many patients who don't want to be examined, and I take it as it comes.
Yeah.
So I also allow them to examine themselves and show me what it is that they find uncomfortable or painful.
Right.
So again, some of the stuff about vulvodynia, previous sexually transmitted infection, secondary vaginismus, women with menopause with severe pain, all of these women can also suffer with vaginismus. So it's about being open-minded to the cause and identifying what can be treated quickly to give relief.
Very true.
And sometimes in the clinic room itself, the first appointment, I try to give the patient the reassurance and the confidence that it is treatable, whatever the approach.
I think that is very, very important, ma'am, because firstly, people, as ma'am also mentioned, that, there have been so many quacks around. And of course, that doesn't work. And then they've lost the hope that things can be done.
Not necessarily that they've been to quacks. They may have been to legitimate clinicians, but because in our country these things are not openly taught, even to doctors.
That's true.
And clinicians, and they may not have seen the kind of patient load as well. So they don't have the time, or they don't have the patience, or they have a vague idea of what needs to be done, but they don't know for sure. And unfortunately, what happens is that lack of confidence, it gets transmitted to the patient.
Very true.
And then the patient decides, well, she's not in the right place. And then she loses confidence in the entire fraternity. The chances of her actually reaching another doctor becomes less and less. So like the patient who came to me, and this is just because it's recent, but several patients, they will not see another doctor for at least 6 months. They don't go, it's not like they're doctor shopping. So, for example, when patients are looking for second opinions, they will go quickly from one doctor to another just to confirm what they want. But with vaginismus or erectile dysfunction, sometimes patients will not build up the courage to see another doctor for almost 3 to 6 months.
I think one reason is that, which you rightly mentioned, that when they see that the doctor is not even confident about my problem, so they lose the hope on the whole fraternity that nobody can solve my problem. Second is that because it has been such a big taboo in our country, so people gain the courage to talk about it once, and it's difficult for them to gain that courage to talk about it again with another one.
Sometimes what happens, and it can go the other way around, is that they're used to telling a story.
Yeah.
Like somebody, if they've seen many clinicians, they'll tell the story. Oh, my husband did this to me on my wedding night, and then this happened, and then this happened, and that's why I'm so terrified. I'm so afraid. I can't do this, and I can't even do this, and I can't do that. And see, now my mother-in-law is treating me like this. So there's this big story that gets created, and every time they meet another clinician, that story becomes a little bit fatter, and a little bit fatter, and a little bit fatter, and the emotions get embedded. All the story. Look at me. I'm the victim. I'm being tortured, and this, and now he's going to leave me, etc., etc. The story becomes deeper and deeper and deeper. So, some point, it's just not that they haven't been heard; it's just they've told the same story too many times.
Wow. Yeah, ma'am. I don't know if you can give a number to how many women you've treated for vaginismus.
vaginismus, I mean, the huge numbers are not there. I get consulted a lot, but treatment successes, I would say every year, maybe between 8 and 10 who get pregnant. And but my treatment cycles are quite long, so they can be anywhere between 3 to 6 months long
course.
because the couple engagement matters. And then you can say maybe I actually consult with 10 times that number because less than 10% people actually want to do the work.
Yeah.
Most of them will say, oh, we don't know, we don't have the patience, I don't know, we don't live together. I have so many couples because they're IT professionals, they don't even meet each other till the weekend. Or one of them will be on a transferable job, so they'll be transferred here, there and everywhere, and the wife will be stuck in one place with the in-laws or with some parents or something like that. So that is also a big factor in why patients don't show up.
Yes,
For therapy.
So,
or they will want somebody who can give medicine. So there's two extremes. One couple who doesn't want any medicines, like, oh, we don't want to see a doctor give medicines, and the other they will say, oh my God, you don't write medicines, you can't be a proper doctor.
yeah. I know this is the same kind of an experience we are getting at Curix, that there are some people who are like, I don't want any medicine, and some like, get me a doctor who can give me medicines and just treat me. I don't want any therapy, want any therapy, just give me medicines, I'll be fine.
So if you're a doctor who gives therapy and delays giving medicines, sometimes they don't like it. So if you're a doctor, you should be able to give medicine. I can do talk therapy with anybody.
Yeah.
But you need the right talk therapy. It's not, and when you need medicine, you need the right medicine. So it's not about anybody and everybody can do the work.
I think this is a very important message. I would like to repeat that thing that ma'am said, that talk therapy has to be given by the right person, and medicine therapy also has to be given by the right person.
And the right kind of talk therapy, because just talking about it also doesn't work. You need to get to the root of the problem and solve it. That's what moves them forward.
Yeah.
Them talking about the problem doesn't usually move them forward after the first time.
Yeah. I think this is a very important message, ma'am, if you could give to the patients, that they think that, oh, talking would heal me. So how would...
Talking is therapeutic, and talking can be healing to the right person when answering the right questions, because it helps you to get to the root of your problem. And sometimes just a realization of where you might have picked up some certain beliefs, certain understandings, certain conditionings about where your problem might be coming from, just by openly talking about it and answering questions can help you realize that might not be the accurate interpretation of what happened or what didn't happen. And that itself can lower the anxiety level significantly and increase the possibility of your confidence in the fact that you're going to get treated.
Wow.
So the other thing I would like to say, the whole evaluation depends on asking questions about yourself, your childhood, how you grew up, what was the communication between your mom and you, or whoever was the lady that you communicated with about your periods, how your periods started, what were the beliefs about periods, what are the beliefs around boyfriends, having boyfriends or not having boyfriends, any kind of childhood experiences. All of this will be asked. So when you go to a therapist or a doctor, be prepared that you don't want to hold anything back, and there's no point lying or hiding things, because they don't get a complete picture of what's happening. And it's really important, because when you attend with your partner, that makes a huge difference, because he gets to hear for the first time the impact it's having on you, and you get to hear the impact it's having on that person. And because you have a third neutral person there, they get a chance to reflect back to each of you what might be interfering with you making progress, both on the relationship level as well as on the sexual level. Both these aspects are important, and they go hand in hand. Without a great relationship, it's very difficult to have great sex. And to have a great sexual relationship, again, the bond has to be improved. So both things have to be managed together, and that's what sex therapy is about.
And if anybody wants to really treat sexual dysfunction, it has to be a combination of right medicine and right therapy.
Yes.
And it is a journey, because people think कि आ गए हैं हम medicines दे दो, therapy दे दो, जो भी देना, लेकिन हफ्ते भर में ठीक कर दो.
Own their sexuality and pleasure, like we talked about in the orgasm things, because sex is meant to be pleasurable. It is meant to reward you for having the body you have, for you to be able to engage. And it's not just a physical experience, it's also a spiritual and a sensual experience that you are entitled to. It's got so many health benefits. So why wouldn't you want it? The only reason you don't want it is because you compromise your sexuality, your communication with your body, because you think somebody else needs it more, i.e. your partner or your mother-in-law, somebody. It's all about having babies and the rest of your life doesn't matter. That's not true. Your main relationship is always and should always be with your intimate partner, whoever that is, and your investment is in that relationship. The baby is a happy side effect of a very great and amazing sexual relationship. So experiencing pleasure is much, much more important than just, like one patient said to me, is the vagina a pipe? Like, is that why it needs dilating? That's why you need to create a bigger hole? I said, no, your vagina is an accommodator. Penetration is a word that's coined by a male sexologist.
That is very true. Thank you so much,
Thank you.
ma'am.